Welcome to SROA Soundboard, a podcast for radiation oncology administrators. Here's your host, Tammy McCullough.
Hello, I'm joined today by Dr. Lauren McCullough, co-principal investigator of Voices of Black Women, a groundbreaking initiative led by the American Cancer Society. Voices of Black Women is a collective commitment to understanding and improving the health of Black women across the nation. Welcome, Dr. McCullough.
Hi, thank you so much for having me.
My first question is, why did the American Cancer Society decide to undertake this study?
Well, the American Cancer Society has been conducting some of the largest population studies around cancer prevention for about the last 70 years. And what we know is that while these studies have been really foundational in helping us to improve our public health messaging for risk reduction for cancer, they haven't been able to adequately speak to racial and ethnic minorities, their unique risks and opportunities for cancer risk reduction. And so really it was with this understanding from previous work that we really needed to be able to dig in deeper into certain race and ethnic groups to be able to guide new understanding and discoveries around cancer risk and cancer prevention, particularly among Black women.
Why do Black women experience poorer outcomes in healthcare and cancer care relative to other populations?
So in terms of thinking about outcomes for Black women in cancer, it really is multifactorial. There are a lot of different reasons that Black women are thought to have poor outcomes. Some of them include lack of access, whether that be via transportation or high quality facilities, insurance or education. And also, it's thought that these poor outcomes may be a result of their lack of inclusion in previous research studies and clinical trials. So maybe, the guidelines that were set or the medications that have been developed are less efficacious in this particular group. There are also reasons that right now are emerging and not yet established around sort of social and structural inequities. So when we think about racism and discrimination as a driver of poor outcomes, and those are the things that we want to try and explore in Voices of Black Women.
Why is the focus on Black women who have never had cancer?
That's a really great question. So when we're doing these large prospective studies and we want to be able to speak to cancer risk, it's important that you start with a group of people that don't have the outcome of interest, in this case, cancer, because we want to understand why they develop cancer. So we can't start with a group of women that already have the outcome of interest. You have to start with a population of people who don't have the condition. And then we ask about, characteristics over time, their medical conditions, their engagements with healthcare, their lifestyle and behaviors. And we can better estimate among those people who go on to get cancer versus those who don't, who had a higher prevalence of certain behaviors, characteristics, lifestyles, environments. And that's how we get to our conclusions about cancer risk. So it's important to start with individuals who are cancer-free. That way we can guide the population on what is driving those cancer outcomes.
The study is supposed to last for at least 30 years. So how will participants' contributions of varying lengths impact the research? And do you envision people actually participating for that long?
Right, so 30 years sounds like a really long time, and it is. And one of the things that I think is important for people to consider is that cancer is a disease that takes decades to develop. And so if we're asking people to join us without cancer, we need to have time for cancer to develop in some individuals and then obviously not develop in others. The way the study is designed is with that long-term commitment in mind. And so after an individual enrolls in the study, what we're asking for is about a 1-hour time commitment per year, just for them to update us on, their behaviors and lifestyle and characteristics and engagements with the medical care system. So it really is a low commitment, but we do need that long period of time because it takes a long time for cancer to develop. And over time, we also learn new things, new questions we should be asking, new exposures that are potentially related to cancer. And so the beauty of a long-term study like this is that it gives us the flexibility to ask new questions over time.
What kind of information will you be gathering, and how will researchers use the data?
So we are really interested in covering the breadth of a person's lived experience. And so that means that we are asking sort of baseline health information, like do you have medical conditions? Are you on certain medications, vitamins, supplements, family history of cancer and other diseases? We're also interested in your behaviors and lifestyle. So are you physically active? Do you live in a neighborhood environment that has access to healthy foods or to sidewalks and green space? We want to know how you're sleeping. We also have a battery of questions around community and social support and mental health. And for this demographic specifically, we're also asking very detailed questions about generational wealth. We're asking about experiences of racism and discrimination. And we're also asking about childhood experiences of economic lack, as well as any experiences of trauma. So that's sort of a high level flavor of the types of questions that we ask. And it's because we feel like all of those things are important, not only for health outcomes, but how people choose to engage in healthcare.
What are the ultimate goals for the study? And related to that, how will the study data specifically help with cancer care?
So their goals are really to better understand why Black women get these more aggressive types of cancers that we don't treat well and have poor survivorship. And then in parallel to hopefully improve survival among those individuals who are ultimately diagnosed with cancer. And we feel like the study data will provide new opportunities to really understand risk in this population in a way that hasn't been done before. With the number of women that we're planning to enroll who cover a wide range of demographic characteristics besides being Black and female, we can really speak to some of the nuances of their experiences in healthcare. And so, you know, in 30 years, I hope to be able to look back and say we've really made an impact. We better understand cancer in this population. We have tailored our public health messaging for this population in a way that's culturally relevant, and that we've seen changes in the numbers of women diagnosed with this disease or changes in the number of women surviving it.
Will Voices have partners who can use the data that's gathered?
Absolutely. So in these types of initiatives by the American Cancer Society, the amount of data that's generated is too much for us to manage alone. And so we really survive and thrive off of having partnerships within the scientific community to help guide some of the research initiatives. And so we expect to have priority partnerships with HBCUs and minority serving institutions, as well as minority investigators who can bring their own research questions around cancer and other health conditions to help sort of move the needle in this population.
The historical mistreatment of the Black community in health research may make Black women hesitant to participate. So how do the study researchers and others, like healthcare providers, that are encouraging participation reassure potential participants?
So there have been a number of, historic instances of Black bodies being used and abused for medical advancement. And I think the first thing as a researcher or a provider that you do is to really understand that history and to understand where those hesitations come from. And so what we've done in Voices first and foremost is to listen to women who we seek to engage with, to understand what the challenges are, what the barriers are, but then also to understand from their perspective, what are the opportunities to overcome those barriers. And so from those listening sessions is really how we developed and designed this study in a way that feels relevant and sensitive to the mistreatments of the past. And so I can just give a few examples. I mean, the first thing I'm hearing, you see me, I'm a Black woman myself. And I think oftentimes that has that is what has been lacking in research studies of minoritized populations, is having representation on the study team, in the science, leading the science. And so 80% of our scientific leadership represent Black women. And so as we were building the study, it was with a certain understanding and cultural sensitivity. We've also tried to optimize the study in a way that doesn't infringe on women's time and makes them feel seen and valued and respected. And so those are the things that we've done to try and engage women in a way that feels meaningful, but also to mitigate some of those concerns that have very valid underpinnings.
Coupled with that is maybe a concern for data privacy. How are you ensuring that participants remain anonymous and that their data are protected?
Great question. So the ACS has really a great system and network for privacy for all of our cohort participants. All data are protected to the fullest extent of the law. And from a practical matter, what we do is we keep our PHI, personal health information, so your name, your birth date, your address, completely separate from the survey questions. And the only people that have access to that, personal health information are our study team members that need to follow up with participants. As a scientist and even as co-principal investigator of the study, I can never link your survey data with your personal information. That's like a firewall between those two groups. And so by having the data protection legal procedures at the ACS and then practically ensuring that the personal information is kept separate from the survey questions, we've been really successful in the last 70 years and not having any incidents where there's been, a data leak or someone's information has gotten into the wrong hands.
Why does the study need at least 100,000 women? And what happens if you don't get that many, or what happens if you get more than 100,000?
If we get more than 100,000, that would be fantastic. So the number 100,000 is really based off of really boring mathematical statistical calculations called power calculations. And we use those calculations to determine how many people are needed to actually detect an association. And so based on those power calculations, 100,000 was the number that we needed to be able to detect small associations. And I think what people have to remember is that when we say 100,000 Black women are not a monolith. And what we want to be able to do is be able to speak to the differential experiences that Black women have. And so 100,000 seems like a lot, but if we then want to be able to stratify, say, by ancestry, or we want to be able to stratify by geography, that 100,000 gets smaller and smaller to be able to make those comparisons. So by starting with that very large number, it enables us to be able to look at nuances even within a group of Black women.
Why are only certain states eligible to participate?
So the determination of what states would be eligible was really based off of census data. So when we looked at the census data, we looked to see where do most Black individuals live in the United States. And not surprisingly, it's very much clustered in the southeastern region, up to the northeast and in California. And so based on those census data, we realized that over 90% of Black women live within those 20 states. And so we found, we thought that it would be efficient to target those states, given that that is the majority of where Black women live, and our ability to be able to follow up women over time.
How can radiation oncology administrators support this study?
Anyone that touches cancer, is affected by cancer, has a critical role to play in this study. I think first and foremost, just being aware of the study yourself so that you can speak about the study, and you can go to voices.cancer.org and look at our FAQs. Really promoting the study within the patient population, emphasizing the importance of the study and why Black women need to participate in research. I think is a big and critical component. And I say, even though it's a study that is designed specifically to address Black women's health, it really is going to be informative for public health in general. And so the more people we have advocating for the study and can recruit the numbers of women that we need, I think the sooner we can actually get to answers.
And why are you, as a co-principal investigator, really excited about this undertaking?
Yeah, that not very many people get to say that they built a cohort in their career. These are not things that happen every day. And I've spent the past 2 decades studying cancer, the last 12 years really exclusively focused on Black women and cancer. And oftentimes in research, there are certain things you just can't do because you don't have the numbers, or you don't have the data and you don't have the information. You say, gosh, I wish we would have asked this question, or gosh, we wish we had this data point. And so this opportunity that was presented to me by the American Cancer Society represented an opportunity to live out that dream of, oh my gosh, if we could ask this, I would want to ask this. And so it really is sort of a culmination of 12 years of research and thinking through, well, what are the questions we want to ask? What are the data we want to collect to really be able to get to answers that really have evaded us in the scientific community? So it really is an honor to lead this study, and even more of an honor to lead it alongside of other Black and brown women who are committed to addressing disparities in cancer among Black women.
Well, thank you very much for your time today. It's been a pleasure to speak with you.
Thank you.
Thanks for listening to today's podcast. To learn more about SROA, visit www.sroa.org.